Hi, I'm Cathy with Level Up RN. In this episode of Ask a Nurse, I'll be answering your questions about listeriosis, such as what is listeriosis? What are the signs and symptoms of listeriosis? And how is listeriosis diagnosed and treated? Listeriosis is a foodborne illness caused by the bacteria Listeria monocytogenes. Listeriosis is not the most common foodborne illness, but it is one of the deadliest with a mortality rate of approximately 20%. This is partly due to the fact that this bacteria, unlike other bacteria, can grow and multiply at refrigeration temperatures, which makes it difficult for food industries to control. People get listeriosis from eating foods that are contaminated with the bacteria. Foods that are more likely to be contaminated include deli meats, hot dogs, unpasteurized dairy products such as raw milk, soft cheese, raw sprouts, and smoked seafood. Individuals at higher risk for listeriosis include those with a weakened immune system, pregnant women, infants, and people over the age of 65. Young, healthy individuals rarely develop invasive listeriosis. Most people who ingest listeria do not have any symptoms or have more mild symptoms such as a fever, muscle aches, nausea, and diarrhea. However, if the infection spreads from the intestines to the nervous system, causing invasive listeriosis, then more serious symptoms can occur, such as a stiff neck, confusion, loss of balance, and seizures. It's also important to note that listeriosis is particularly dangerous for pregnant women and can lead to serious complications such as a miscarriage, stillbirth, premature delivery, and serious health problems for the baby after birth. Listeriosis is diagnosed through laboratory testing. If your provider suspects that you may have listeriosis, then a sample of your blood, spinal fluid, or amniotic fluid will be obtained and tested for the presence of the bacteria. Adults and children with a healthy immune system may not require treatment for listeriosis. However, individuals with severe symptoms and high-risk individuals, such as pregnant women, are treated with antibiotics. The most common antibiotics used to treat listeriosis include ampicillin and penicillin G, which are administered through the IV route. In order to prevent listeriosis and other foodborne illnesses, it's important to wash your hands and food surfaces thoroughly, separate raw foods from cooked foods, cook meat, egg, and poultry dishes to the correct internal temperature, and wash produce thoroughly before eating. In addition, individuals who are at higher risk for infection should be careful about the foods they consume and consider avoiding some of the high-risk foods we talked about earlier, such as deli meats, hot dogs, and unpasteurized dairy products. That's it for this episode of Ask a Nurse. I hope it was helpful. If so, be sure to hit that like button. And if you have a health topic or question you'd like me to answer in a future episode, be sure to leave it in the comments. Stay informed and stay well. We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.